I know you really want stretches. I know you want other manual techniques, and I will give some to you. But bear with me. I want to go over some helpful hints that shows how I end up treating my patients with hypermobility in the long run, okay? Stretches feel amazing, manual techniques feel great, and it reduces your pain, and I want to help you with that. Again, this is the learning more about your body part that makes your brain tired and is hard, and I understand. But stick with me on this one, okay? I know you're gonna love it, okay? So the way that I treat my patients is I go through a program called Driver's Ed for Hypermobility, okay? I didn't learn this from somebody else. I kind of made it up for myself over time. This is a series of different metaphors that helps you understand your body a little bit better and kind of puts a mental image on what your body should be doing, okay? So lesson 1, staying in your lane, okay? Imagine when you first started to learn how to drive, you're like, what are these white lines for and everything, okay? So let's go over that metaphorically, what this is, okay? So of course you know about that center line here, okay? And then you've got this solid white line that says like, hey, you're going a little bit too far. So let's kind of go back to the left a little bit. If you go a little bit too far, you're nodding off or something like that, then you got the little fun rumble strip or whatever else you'll call it, okay? So it gives a little bit more feedback, like I need to move over a bit more. Sometimes there's a little grass on the side, but we have those guardrails on the end, and that's what stops you from going any further, okay? And in a metaphorical sense, each of these things represents something in our body that keeps us from going out of alignment, having dislocations in the worst sense, but overall protecting our ligaments, tissue, and stuff like that from harm, okay? So think about anything past here is damage. All right, so this is would say the normal side on what should happen. Now let's see what happens when have hypermobility, okay? With hypermobility, you do still have this line here, but it's a little bit faded, okay? Maybe that reflective coating that was on it originally is gone, and this is just kind of dulled out. And so you're having to look like, am I in the right place? Rumble strips, they didn't put them in there, okay? Or if they do, it's kind of skip here and there, okay? And we do have our guardrail, but for some, it may be, you know, those ropes they put in queue lines, and maybe just like a regular rope made out of velvet or something like that. Not really gonna stop us from doing anything, but if you push hard enough into it'll slow you down, okay? So what this is all getting at is we don't have the feedback system that's as strong to tell us if we're going out of alignment, if we're going into a wrong position, and we end up causing damage to our body because we're using the wrong things, okay? So going through a little bit more specifics here, we have 2 main mechanisms that we use in order to keep our bodies from going out of alignment, okay? So one is gonna be let me do a different color here. One is gonna be our muscle spindles. Okay, our muscle spindle is going to be one of the first things that we can use, okay? So it's obviously in our muscles, and we can actually change this when we tense our muscles. So this is active, okay? And then we have passive structures, so passive, okay? And these are going to be in our ligaments, in our tendons, and just the joint capsule itself. Golgi tendon, organs, and Pacinian corpuscles. Okay, and there's a few other little things here, but these are the main ones, okay? And then actually we have stuff in our skin and our fascia. Okay, these different organs lay in those passive structures that are supposed to be giving us feedback. Well, if our ligaments are supposed to be like nylon, where we pull on it and it holds very well, instead it's more like a rubber band. So we don't give that black and white feedback of like, hey, we're going too far. It's more of like, I think I'm going too far. It's a lot more gray. So we're not getting as much feedback from the passive structures. So what do? We rely a lot more on our active structures, the muscle spindles. How do we do that? We co-contract our muscles. So we tend to tense a whole bunch. Now, metaphorically over here, we're looking at this road. In our car, we're white knuckling, and we probably end up doing that anyway to get feedback of knowing where you are in space. So you're tensing a whole lot more than you should be in order for your body to know where you are in space. Okay, which is fine to a short extent, but it causes a lot more issues in the long run, because imagine tensing your arms, doing this for 10 seconds, you can try it now, and then you relax like, ooh. You have to kind of stretch it out a little bit, because it's actually, the muscles take a little bit for them to fully relax, especially since you've been contracted for so long. So this is where you get a lot of the trigger points, a lot of those knots and stuff like that in different places, and you feel like you just need to stretch all the time, which stretching, this is kind of going back to the beginning, stretching is great if we're able to do it correctly, and if we're able to follow up with stabilization in our body afterwards, which is a part of using this passive system, okay? Usually when I'm talking through this metaphor, this is when my patients start saying like, okay, great. How do I do that? Good question. All right, so coming back over here, so here's our car. I'm not gonna draw anything fancy because you've seen my drawing skills so far. So with our car right here, my job as a physical therapist, and this is, I didn't learn this from other people. I slowly started to figure this out, and it's only recently I've been able to really put into words how I go about starting to treat people, okay? I look at anything that I can do to get you back into your lane, okay? Whether that's, your shoulder, hip, and the difficult part is if you don't know what the body should be doing, what the body's normal reaction should be, whether it's by feel or looking at somebody, then it's gonna cause issues, okay? This is where you need to find a PT trainer or somebody who knows not only correct form, but how you can actually do this while using the correct muscles, because people with hypermobility, you are masters at, I don't want to say doing things wrong, but at hiding compensatory strategies. You're just amazing at it. Because I can see some like, man, you got great form, and I feel their back, like, how are you tensing your back that hard? Because you figured out a way to do it to keep going, but you're going the right direction, but you're kind of damaging other things, okay? So again, finding a PT who has skilled hands or just understands the whole concept of like figuring out how to help you with your body to do the right things and to have the patience to get you back into your lane again. That's the overall theme that I think you should look for with a PT who is considerate of those things, okay? So again, my job is gonna be getting you back into your lane and then teaching you how to stay in your lane, okay? So I may start with manual techniques, and then we'll go into some different exercises. Now, I don't do, here's a bunch of manual techniques, okay, we'll see ya, or let me just throw you on the bike. Doesn't work like that. It's gonna take a lot of hands-on. I use, it's called PNF, proprioceptive neuromuscular facilitation. There's different schools of thought with that. I found really good, it's really helped a lot of people with that. But other people may have better methods. I would love to hear about it, okay? Okay, so I need to work on retraining for you to see these lines, but then also how do we even get back into that lane again, which is gonna take time. And this is where this is the difficult part. It's just a lot of thinking. It can be mentally exhausting. And it's frustrating because everybody else doesn't have to do that. And that's where the part that I wanna have compassion for you is that it's hard. It sucks because other people, they just live life like, oh great, this is no big deal, and you're just like crashing left and right like, oh my gosh, I can't keep up, and you're having to do so much more work all the time, okay? But there is hope if you can kind of work through a lot of these things. Really, the first couple times I see somebody is just getting your pain under control and just understanding your body and using these metaphors to figure out what all this looks like and to have a direction. Because when everything is hurting, you just don't have a direction. Other PTs, when you come in and say like, oh, my elbow, my hip, my shoulder, blah, 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 they're like, I thought you came in here for your knee. Like, they're just give that deer in headlights look. My pain chart has like location 1, 2, 3, 4, 5, 6, 7. Okay, because I'm used to this because I recognize all these are related to each other. Okay, so that's the main part of lesson 1 is staying in your lane. There are a whole lot more things that I will go over with you. I do want to add more stretches and more other techniques that you can use. It's just very hard if you don't know the overlying theme that we're looking for, because we tend to chase what gives me pain relief now, which is hard because you need short-term relief, and I get that, and I will hopefully help with that. The other part that I would like your feedback on, I've been practicing for more than 10 years and only recently starting my new business. So it's been about 6 months as this video is being made. And I'm getting a lot more outreach from people from not only across the country, but across the world. And I want to know how I can help people without breaking the rules when it comes to giving medical advice is basically what I'm not allowed to do. So if any of you have any ideas for how I can help people in the long run, I would love to hear it. Send me a message, send me any comments that you have about things. I've tossed around the idea of doing like a webinar or coaching, things like that. But my overall goal is to help people like you where you have been pushed aside from different doctors, from other PTs, and your complaints have been nullified, saying like, must be in your head. Because that's most of the patients that I treat are people who have been pushed aside and said, this has got to be in your head. When I understand the complexity of what's going on, and I'm constantly learning too. I don't know everything, but these are the people that I want to help. If I can help by teaching other PTs this concept, I would love to. But part of this is also running a business too, and just feeding my family and going out on my own with with our clinic. So I would love to hear feedback from y'all on ways that we can kind of go about helping you. But I appreciate the feedback so far. I just love the compliments from everybody, and I hope to put out more information soon. So thank you so much.